Welcome, everybody. I'm Dr. Fred Liss, the president of HURT, and we're here today for the HURT Healthcast number 5. Today, we're really lucky and fortunate to have Dr. Brandon Nudelman, who is an orthopedic sports medicine specialist with OPA Orthopedics out in Seattle. And we're going to have a little conversation with him about all things HURT, but also about his practice and what it's like to practice out there on the West Coast of the United States. So, we love to just have nice conversations. We're so lucky to meet so many wonderful physicians across the U.S. And maybe I think one of the first things that I was thinking about wanting to ask you is tell me a little bit about the dynamics of practicing in the Seattle region. Is it dense? Is it crowded? Are there lots of orthopedists? What's it like out there?
Yeah, I mean, it's a dense area. There's a lot of competition. There's a lot of orthopedics, which is, great for the patients, but obviously comes with the challenges in terms of navigating the system, figuring out where to go. And then Seattle itself, obviously, it's this big metropolitan area in Western Washington. And so in my practice, I see people not just from downtown Seattle, the greater Seattle area, moving out onto the east side, Bellevue in particular, where I practice, but we get this funnel of patients coming from central Washington. Some even come down from Canada, which is not too far to the north. So it's a great area to practice medicine.
That's really cool. So it is a competitive region, and I always, you and I were talking earlier before we came online about both of our fathers. My father was, and your dad is, an OBGYN. Back in the day when my dad practiced, competition, advertising, all that stuff was taboo. We didn't do that. But the reality is now that we live in a world where there is a lot of competition. Healthcare is a highly consumed product, if you will. And so I wonder, how you view, and, obviously I'm from HURT, we're all about access. Tell me what your view is in a densely populated area, about being available. The old 3 A's: availability, ability, and affability. What's it like, the pressure that you feel to be able to get patients in and to be available? What is that like in the Seattle market?
Yeah, I think exactly what you said. Those 3 A's are ingrained to us in our medical training, and especially someone like myself in the private practice setting. You need to, market yourself, get your name out there, let the patients know you're here and ready to treat them. So by all means, whether it's the patients I'm dealing with or potential referral sources like primary care physicians, my goal is to always be available and have that access, be an access point for the patients, for the primary care doctors, so that these patients can get in. And like we said, it's a competitive market out there. It's difficult for patients to navigate, I think, sometimes, knowing where they can go or who they can go see. And so, for that reason alone, it's incredibly helpful to always be there, ready for your patients when they need, have someone that's willing to take on their care. And, I think at the end of the day, it's better for the patients. They get physicians that are committed to their care, who are trying to be available for them to answer their questions as they arise. And I think that is what we make each other, keep each other as surgeons and physicians to a higher level, so that we can provide the utmost care to the patients at all times.
Yeah, I think you're right about that. And I also, having had 30 years experience in practice, and I practice with a large group, and I also practice in a small group setting, academic and non-academic. I think one thing is universal, and that is people appreciate easy access to get in and see their doctor, and they don't want obstructions, which is really what brought us together, your group and my company. The founders of our company created a software that gives access to patients, ready access when they need it, when maybe your lights are off, we're still on there for you. And we think that it really does work very well in densely populated areas. We've seen that on our platform. So yeah, I think this is an important evolution in our healthcare system. I think we've pushed patients away from doctors for a long time. When our dads were doctors as young men, I think things were a little bit more relaxed. I think people went to the doctor, they made an appointment, they hung their shingle out, they went. The corporatization of medicine has occurred, and we have to keep up with it as physicians. And that doesn't mean that it's only about marketing. We still have to be really good docs. So yeah, I really appreciate that, that at such a early stage in your career. I mean, you've been in practice, what, just about a little less than 10 years now?
Yeah,
Yeah.
yeah. I'm
Um,
I'm still on the earlier end. I don't have as many gray hairs, but it makes me work even harder to show patients that I'm just as good of a physician and surgeon as the guys down the road potentially. And at the end of the day, I'm going to give them the best care that I would give to a family member.
right. That's beautiful. Tell me a little bit about your practice. I mentioned earlier you focus in sports medicine. What are your passions? What are the things that you like to do the most?
Yeah, I mean, like you said, sports medicine is my passion. That's what I went to fellowship for. Always been involved in sports growing up. So not only is it a great way to stay connected and essentially live vicariously through my patients, but I just enjoy treating those type of injuries, providing sports coverage, being on the sidelines. But then also there's the surgical side of it. So the knee is one of my passions, as is the shoulder within sports medicine, and that is pretty broad in terms of what we can do. So, as sports medicine specialists, we're generally known for the ones that are using arthroscopy, the minimally invasive type surgery, but that can become much more complex. So, like you talked about, shoulder replacement, that's an area of my practice that I really enjoy. There's things like cartilage restoration, can be very complex and a little more in depth in terms of what the patients may need. Sometimes they need bony correction with what we call an osteotomy, in addition to a cartilage replacement procedure. And so those kind of things I think are really exciting aspects of the shoulder and knee, which I look forward to continuing to be a really big part of my practice, in addition to the sports type coverage that I've been providing.
Great. Tell me a little bit about the sports coverage scene. Do you cover teams or colleges? Are you a team physician anywhere?
Yeah, currently I'm a team physician for Liberty High School. So I cover their football games. I'm there at the sidelines. And then as I start to progress in my role, I'll probably look into other opportunities. But I've got experience in fellowship, working with high level professional athletes, as well as covering at the college level. And really, no matter the level, I mean, it's such a great way to be involved. You're part of the team. You're helping get these athletes back onto the field, which is very important to them, obviously. And so I love being able to immerse myself in that.
Hmm.
Um,
Great. One of the things that we're developing at Hurt that I'm very curious to ask you about is we have a program that we've developed for Hurt trainers, people who can. There's a gap, it seems, and I want to know what you think about this. There's a gap between when somebody, let's say, has their ACL reconstruction or they have a rotator cuff repair, from the time they finish their therapy to when they're really actually okay to go back to sports. There's kind of a gap there that a lot of times people finish with therapy and they say, okay, you're discharged, but they're not really ready for sports. So what's your view on that period of time, and how do you handle your athletes who have injuries that are healed, but in your opinion are not battle ready? What do you do with them?
yeah, I think that's one of the hardest parts of a major recovery. I mean, you think the surgery in itself is all you need, and let a little time go by, and then you're ready to go back to sport. But it's very much the opposite. Surgery is just a single day event, and then you spend, depending on the injury, 6, 9, 12 months even in this recovery period. So I think it's just being there for the athletes and your patient, and helping to educate them. It's a process, and I can obviously do my part, but they very much have to be invested in their care and their rehab.
Hmm.
So that's why being in touch with a good physical therapist is crucial. Um, you know, it's not just getting back your range of motion, or letting your ACL incorporate and heal, but going through the gradual strengthening protocol, incorporating into some of that return to sport activity, and then obviously the specific testing to determine that the athlete is ready to go back to sports. So I think at the end of the day, just being there, answering their questions, and helping them with that education, and ultimately giving them goals, kind of knowing, okay, I need to get 90% strength compared to my good side, and that's going to get me back to sport. So getting the patient in tune with all those aspects of the recovery process is imperative.
Do you find that some of your competitive athletes end up going to their own personal trainers, or do they go back to the school and the trainers at the school? Who handles that guidance during the gap? Because obviously we as physicians can't be seeing the patients, every week or every other day to talk about progress. But where do you see them going to get that rehab when they're done with therapy? Where's the best place to go?
No, I think at the end of the day, it's what's convenient for them as a patient, and who they have access to. Obviously, at the professional level, these athletes are surrounded by physical therapists, ATCs, you name it, and so they have that, every day when they go into work. Most patients, myself, yourself included, we don't have access to that. So, it's just a matter of getting plugged in with a good physical therapist, someone that you trust, someone that you may have a relationship with, or someone that I could potentially recommend. And you're spending, week in, week out with that therapist. Obviously, I'm continue to be a resource during the rehab, but it's really about finding someone maybe close to them, someone they trust, someone convenient to be involved in that recovery. I think at lower levels, there tends to be therapy as an option. So even in high school and definitely in college, you have the therapist around. But for the weekend warriors, or someone who doesn't have that professional therapist involved in their program, it's just, there's tons of therapists, fortunately, in Western Washington and in Seattle, that they're out there for my patients.
Well, as I and we at Hurt really believe that gap represents an opportunity to do a better job for patients. We have been building a program throughout our network to actually train trainers. Now, I personally go to a personal trainer, and he receives a lot of referrals from physicians and from physical therapists to pick up that gap. And we really believe in that at Hurt. And we feel like one of the things that we're really dedicated to at our company is making sure that patients get to their doctors when they need to. We fill the gaps where things are not happening to the extent that we think they should. And we're really excited to pretty soon roll out a program where we have Hurt trainers that we certify that can actually understand how to get an athlete back to the field in the places where, as you point out, not everybody has access to them. So we want to have certified trainers so that those athletes that have surgery and care from doctors like yourself might have an access, a ready access to someone who can help them get back to sports. So that's coming in the future with Hurt. I think we're going to have more conversations about it.
Yeah, I'll throw in a little extra a piece that comes to mind. I mean, that's terrific that's out there and going to continue to grow. I think one of the challenges, with anything you consume, so whether it's physical therapy or what physician to go see, or who you're going to have, who's going to fix your car. You get this information overload. There's so much out there on the internet, and you read all these reviews and you try to make a informed decision on where you should go. Obviously, at the end of the day, everyone wants the best care that they can find, but to have someone behind these reviews, like a Hurt app, or same thing as if word of mouth, that goes a long way. It's someone you trust. And so I think having these things on Hurt, and so being able to say these are certified physicians or trainers, or you name it, I think that carries a lot of weight and will do wonders for the patients who are utilizing this service.
Yeah, and the great thing that I've realized in the length of my career is that there's a lot of power in the interactions that we doctors have with each other. The fact that an orthopedic surgeon founded this company and that we work with orthopedic surgeons makes a big difference. These kinds of networking things are designed to get that high quality care that you were referring to earlier in the conversation about really raising the level of care per patient, more time, more energy to that individual by creating things that reduce the gap between their care and themselves. And so that's kind of the mission of our company. So tell me a little bit about OPA. How many docs you have, and the breadth of the practice as well.
Yeah, it's a big private group, traditionally based out of Seattle. Now also serving the East Side, as I had mentioned. We've got 20 orthopedic surgeons and then 4 non-operative specialists. So we specialize in the musculoskeletal care, pretty much for everything throughout orthopedics. We'll take care of. We have highly trained fellowship specialists for you name it. We really do everything at this point except spine surgery, but we're a great place to come for any other conditions. We can take care of the non-operative spine patients, so those who may be doing fine with other treatment options. But it's a terrific group. I'm very fortunate to be with them. We recently have earned a prestigious award for Best in the Pacific Northwest, as determined by the Seattle Times. So we're really proud
Awesome.
of that.
That's great.
Voted on. So we're really happy with where things have been and the expansion that we continue. We continue to bring on new partners and grow in Western Washington.
Well, big shout out to Kata Waller, who is, I think, if I'm not mistaken, your CEO, someone who I am very impressed with, and have crossed paths with people that she's crossed paths with so many different ways. And everybody always says that she's a heck of a leader. So I know that you've got great leadership behind the scenes as well as out in front with you physicians. Does your practice, do you handle walk-ins, or do you have urgent care? What's the structure of your day-to-day practice? Is it all just scheduled appointments? How do you guys work your practice?
Yeah, it's all scheduled appointments, but access is huge for us. So obviously, whether it's a referral or whether a patient calls in saying would like to be seen for my orthopedic problem, we do everything we can to get the patients in same week, and in a manner. And I think we've been pretty good at hitting that one on the head. So we're really happy about that service we're able to provide to patients. And at the end of the day, that's what's really most important: providing high quality patient care.
Where do you do most of your surgeries?
So it's split up between, we have a surgery center as well as hospital over in Seattle, and then the same thing, another surgery center and hospital. We can do do surgeries out over on the East Side in Bellevue.
Okay, is there a hospital center that your practice tends to participate with?
Currently, we're utilizing Overlake Hospital for our inpatient procedures, as well as Swedish Hospital in Seattle for inpatient procedures. And then our surgery centers are on First Hill, so not far down the road from our clinic in Seattle, and then also within the Pro Club in Bellevue. So the Pro Club, for your background, if you're not familiar, is a premier health center over in Bellevue, on the Bellevue-Redmond border. And so that's where our Bellevue clinic is located. Within the clinic, we have X-ray, we have an MRI, which patients have access to, and we have the surgery center in the same building. So it's really kind of a one-stop shop over there. We can take care of most everything in-house, and it's a beautiful facility. I encourage you to come out and check it out someday.
Oh, I will. I will. You can count on that. I hit the road quite a bit, and I do try to meet a lot of our clients out in their communities. I think that's one of the things that we love to do at Hurt, is we really build our business on relationships. We also too believe in really good service. We listen to our clients. We pivot based on what they need, and so we are really dedicated to that. So I do hope to see. I want to come meet. I actually have met Kata in person at a meeting before, but I do want to come out and meet the docs. So any questions that you have for us about Hurt?
I'm always kind of interested in, who's on the other end of the app. Obviously, patients can go onto the app and they get feedback on where to go next. But who is it that's reviewing their images and providing this virtual consultation for them?
Right. So I can give you a good thumbnail sketch of that. So right now, although we are a true telehealth company, for the most part, we're not reviewing any radiographs. What we do is we make ourselves available 24/7, 365 for a human being to answer the call when a user of our app and a patient of your practice, or someone who wants to be a patient of your practice can access your practice when the lights are off in your buildings and where our lights are on because we're up all night long. So what happens is a nurse practitioner, an orthopedic nurse practitioner, or ATC, or orthopedic surgeon. Um, I was on shift this morning and taking cases of someone who was about to have a rotator cuff surgery and developed cervical radiculopathy in the opposite side from therapy. So what we do is we receive them, we listen. They give us a description of their problem, and then we have a discussion. That can be telehealth, where we're actually sitting there talking to them and having videos. It can be a text-based thing. They can send us photographs. We can talk to them on the phone. And so what we do is we create a differential diagnosis because you know that 90% of what we do as orthopedic surgeons, we can pretty much figure out what's going on with a discussion. That doesn't mean we can treat them. But then what we do is we say, look, you know, put the hair out from being on fire. You don't need to go to the emergency room. What you need is to see Dr. Nudelman tomorrow because I think you have a distal biceps rupture and you may need surgery. And so we're able to triage in our minds when somebody has an immediate surgical problem versus, well, listen, you've had a rotator cuff tendonitis and a bursitis so many times, you've had multiple injections. It sounds like that's what it is. Let's get you to self-scheduling so you can make an appointment to see Dr. Nidelman in 2 weeks. In the meantime, do X, Y, and Z. So what we do is we make it so that your practice receives these patients in order of priority, and we send a secure message to your practice, and you have a dashboard that you can manage it through and see everything that's coming in and out. So it's just a great way for patients to decrease the distance between them and their doctor rather than getting a message service or finding out that they have to wait 6 weeks for some practices. This is a way where we can tell you, hey, this patient needs to be seen right away. That patient can be seen next week. We give you a good viewpoint on that from the early going. And the other thing that it does is it gives a sense of really great care to somebody. I mean, you know how it is. If you get a call from a doctor right after you hurt yourself, people are pretty impressed. And so when they have this advisory where they're talking to someone who's in the know, they know what they need to do. And that's really half the battle right there. So when they arrive at your practice, it's like, wow, that was really good care. And you said that from the outset. I love that. I think if you as a young surgeon just focus on being the best doctor you can be, you're going to be successful no matter what happens in the community because people want to go to doctors who care. And doctors who care are the best physicians. So that's kind of our philosophy. I mean, we really Dr. Miller and Mr. Ostis, who were the two people who designed this program and this platform. Brett Miller is an orthopedic surgeon. He was just absolutely furious with patients were being pushed around and couldn't get into CX. They couldn't get access to doctors. And when we hit the COVID crisis, we launched it. I started working with them after they had developed the program, and then COVID allowed us to launch it. And then people just said, "Oh my goodness, this is the way it should be." So now everybody realizes immediate access is super important. So that's kind of how we work. And we have a lot of other different verticals in our company. We have a workman's comp module that your practice can use to increase, the capture of patients and your relationship with businesses, enhance them for, employer relations and self-insured groups, et cetera. So we want you to be available. That's really what we're about. We designed this to create a great access for the doctors, or for the patients to get to their doctors. Okay. Well, I'm going to get personal. I want to know, Brandon, tell me about your family.
Oh, well, I'm married. I've got a wonderful wife who I have to say she's been incredibly supportive throughout my whole medical training and now into my career. So I couldn't be where I'm at without her. For first and foremost, I have a lovely two-year-old boy, and he's been also the love of my life. He keeps me he keeps me on my toes. He's a handful, but I it's amazing to be able to go through this with support like that. Same thing, my parents, my in-laws, my grandparents. It's such a blessing to be to be living right down the street and close by after so many years being away and on the road.
Well, I love what you said about your wife. I'm a guy who's been married for 37 years, and I think you're absolutely right. Without support, it's very hard to be an orthopedic surgeon and not have a supportive structure at home. And I'm glad to hear that for you. 2-year-old boy, you're in the thick of it now.
Yeah, we'll see where things go, but he's a good boy, so we're making it. He makes things exciting though.
Great. Any other questions that you have about our platform, about our relationship, anything that you'd like to know?
I think the other thing I think about is what is the ideal patient that is utilizing the Herd app? Obviously, someone we think of the athlete that gets injured in a game and doesn't have access to an ATC a trainer to provide guidance, but can this app be used for someone who hurts themselves, out on the tennis court, or someone who maybe didn't have an injury, has been dealing with some knee pain, has kind of dealt with it for a few months, it's not getting better. Is that another patient that can utilize the app?
Absolutely. So all of the above. So the amazing thing about the Herd app is, and some of the verticals that we're working, it's applicable to virtually every subspecialty in orthopedics. So we see tons of acute, weekend athletes. 85% of our cases come in after 5 p.m. and on weekends, which is the time that most orthopedic practices lights are off, or maybe their urgent care is open on a Saturday. We see everything from people who have had knee pain for a long time and are kind of tipping their toe in the water to check and see if, do I need any care, like people who might need a joint replacement, all the way to someone who's been limping around and periodically gets catching in their knee and they never understood it and they live with it and might have a meniscal problem, to parents who call on a weekend because their kid got hurt in the surf, at the beach, and they're worried and the shoulder is hurt and what do I do? So we really appeal to virtually every type of user. Anybody can use this app except children who are underage. If you're under the age of 18, you have to have a parent who advocates for you on our app. And a lot of what we do is, just discuss problems that people have been having for a long time. But I'd say the vast majority of what we do is to navigate people who did get hurt on the tennis court or in a soccer game, or, their elbows hurting after they pitched 80 pitches when they should have only done 40. It's like that kind of stuff. And the beauty of what we do is we get the patient to the right place at the right time with the right diagnosis. So, if somebody doesn't need to go to ER, we've learned that the average cost of an ER across the United States is about $3,000 to walk in the door, get a sling after you wait for 6 hours and get told to go see Dr. Nudelman. That's what happens. So if we can avoid that and get them where they need to be to see you, in the next 3 to 5 days, because they have an injury that maybe is not surgical or is not emergently surgical, versus I know they've ruptured their biceps or they have an Achilles rupture or they have something that really needs attention. Distal radius fractures a lot of times come in and we tell them to put a splint on, get in to see the doctor tomorrow morning. You don't need to go to an emergency room for that. And so people are realizing that they can have access to care. It's not what happens. Somebody calls up and says to your wife, "Hey, can you get your husband to call me? I think I have a bad injury to my knee." And the old routine was, that network where people would call a friend of a friend of a friend. Well, that's who we are. we're basically access for everybody to have a doctor friend to be able to contact right away so they know what to do. That's what we do.
Yeah. I mean, I have to say, I love the idea of the app, the services you guys provide. I mean, it's concierge medicine in your pocket at no cost to the patient,
That's right.
which I mean, who doesn't want that? So I think it's so neat what you guys have come up with and what you're able to provide to the patients. I totally agree what you're saying. It's so often I see patients in the clinic. They tell me the story. I sat in the emergency department for 6 hours just to get an X-ray. They told me it wasn't broken, and send me on my way. And they feel like they wasted their time. They incurred a large bill, and so to be able to bypass that, I think is such a neat opportunity for the patients. And everyone feels they have an emergency when they have an injury. I think the problem is, not everything truly is an emergency, but everyone wants to know so quick, especially in today's data-driven age, and with Google and all these things, they want to know what's going on. So why not be able to use this resource?
We think that it is past due that people have that access. It's not good healthcare, Brandon. I don't think it's not good healthcare to send somebody to an ER when that ER really should be taking care of really ill patients. It's not good care for someone to have to sit in an emergency room waiting area and then only get told to go see another doctor. What is good healthcare is to give somebody an answer to their question right away so they know what's the highest and best use of my time and my healthcare dollar. And by the way, there's a cost to the stress that comes when you're a parent and you're worried about your child. So we really believe that there is a higher calling to what we're doing. I mean, obviously, we are a business, but we're a business that has a conscience and has a mission to improve and change, move the needle for healthcare. And we think that this platform really applies to so many things. Patient access and access to healthcare services everywhere is really, really super important. So we're really thrilled to have OPA as our client. I wish you and anticipate you to have a wonderful career. You're a lovely person, and I'm sure you're an excellent surgeon with all that training that you've had at in France and also down in Los Angeles at the Orthopedic Institute. So thank you for coming. Anything else I can answer for you before we head out?
No, I mean, this has been very informative, both for me. It's such a privilege to be able to partner with you guys and just have another way that myself and my group can continue to be there for the patients. And again, it's unfortunately the way it is in America. It's such a difficult system, healthcare is, to navigate for patients. And so just to have the clarity on who should I be going to see, or well, I see all these orthopedic surgeons listed on the website, but if it's a need, do I need to go to Dr. A or B or C? And so, to have her to be able to not only provide that guidance, but to also give the patients peace of mind that they're going to be okay, and what may be going on in terms of their injury. I think again, I can't overstate how impressive this app is, and I'm really looking forward to continue to be in contact and maintain this relationship with you guys. Great work you're doing.
Well, thank you. And I'll tell you what, I know that you and I are going to have some more conversations about the trainer, the hurt training aspect, because I bet you there's a place for it in your market, and for you to have relationships with really highly trained individuals who, can get the patient from therapist back to sports and keep you informed and in the loop and have you oversee it. I think that's really super important. So we're looking forward to working with you on that.
Well, wait.
All right. Well, listen, you have a good night. Give my best to Kata. Okay. Tell her I said hello.
Absolutely, I will. Thank you so much. And I really appreciate you and this opportunity.
Our pleasure. Thanks. Have a good night.
I'll personally tour you around the facilities.
Okay. I'm coming. Believe me.
All right. Take care. All the best.
All right. Good night. Thanks, everybody, for taking the time to join us today with Dr. Nudelman from OPA Orthopedics. It was a really enjoyable conversation with him. We have lots to look forward to in the future healthcasts that are coming up. We're going to be going all across the United States, talking with doctors who do everything from joint replacement all the way to workman's comp issues and some of the other verticals that we have, particularly our joint score, which is being vetted and will be published soon. And that'll help us to predict which patients will need a joint replacement versus ones that will need injection. And furthermore, we're just grateful that you all have joined us on this journey. Looking forward to seeing you again at the next Healthcast. Take care and have a great evening.